The Center for the Improvement of Human Functioning International presents this luncheon lecture. Today's topic, Avoid Mental Decline. Your presenter, Rebecca Kirby, MD, MSRD.
Howdy. Glad y'all could all remember to come here today. And that's what we're going to talk about. We're going to talk about avoiding mental decline. I'm Dr. Rebecca Kirby. I'm one of the physicians here at the Center for the Improvement of Human Functioning. And it's nice to see a lot of new faces out here. Well, there's different kinds of mental decline. So I'm going to talk a little bit about the difference between senior moments and dementia. The first thing you see here is called age-associated memory loss. This is normal memory change with age. That is what we call, having the senior moments. Then there's something that's called mild cognitive impairment. This is short-term memory loss with kind of ongoing mental problems. And it's sometimes called the transition between the senior moments and dementia. And there's more of this mild cognitive impairment, we call it MCI, than was originally believed. And interestingly enough, a new study shows that men seem to be more at risk for this mild cognitive impairment, which is kind of a surprise because women are more at risk for the Alzheimer's dementia. And then there's dementia. And dementia is the most serious form of memory decline, which includes your loss of language and memory and your visual and spatial abilities and even loss of judgment. But it can take months to actual years to develop. And Alzheimer's is now considered the most common form of dementia. One of the recent surveys I saw said that they think 6 to 10% of people over 65 have dementia. I thought that was an awfully large number. But they do say that at least 5 million Americans have Alzheimer's. And it's now in that top 10 causes of death for Americans. It's made it up to number 8. And there's been an increase in deaths due to Alzheimer's since 2000. And characteristics, just to remind you about Alzheimer's, are lapses in memory, confusion, changes in personality, language problems, loss of inhibition and motivation, sometimes paranoia and disorientation. Now, when I was going to medical school, and it wasn't all that long ago, multi-infarct dementia was considered the most common cause of dementia. And that's a memory loss that's caused by having little small strokes in the brain. And they may be silent strokes and not even seen unless somebody has an MRI or a CT. And what happens there is those little small blood vessels in the brain have been occluded or restricted or blocked, and that's decreased the blood flow to that area of the brain, and that area of the brain then dies. And with multi-infarct dementia, the characteristics are short-term memory loss, wandering, walking with shuffling steps, loss of bladder and bowel control, crying inappropriately, and problems with money transactions. And this is the confusing part. Multi-infarct dementia and Alzheimer's can coexist. Now, one thing I want to tell you a little bit about is what we know about Alzheimer's dementia as far as the physiology, but I'd like to give you a little history lesson first. Alzheimer's was actually named after Dr. Alzheimer. There was a psychiatrist who in 1906 described these protein plaques in the brain of a patient, a 56-year-old patient who had died, who he had followed having progressive dementia. And so he was the first one, this is a German psychiatrist, to name those plaques, and so he got the whole disease named after him. That was Dr. Alzheimer in 1906, so it's been around for a while. And that's what he observed was these protein, what we call amyloid plaques. We also know that Alzheimer's has neurofibril tangles in the brain. We know there's nerve cell degeneration or deterioration. We know there's a deficit of acetylcholine. Acetylcholine is a neurotransmitter that's very important for what we call synaptic plasticity, which means, brain cells being able to talk to each other. Another interesting finding is the brain of a patient with Alzheimer's is much more reduced in size than a normal aging brain. With a CT scan, sometimes you see something that says normal brain atrophy. Well, the brain shrinks a little bit with age, but in Alzheimer's, it's double the shrinkage. And then there's also some findings that suggest there's an infectious etiology to Alzheimer's. One of the bugs or bacteria is something called chlamydia pneumonia, which has been found next to neurofibril tangles. And there's also some other things like Lyme disease that that bug has been found in association with Alzheimer's brains. So what we're going to talk about today is all those risk factors, biochemical, medical, there's even lifestyle and social risk factors that put you at risk for dementia. And we're going to talk about how we can underplay those and reduce our risks. Okay, now here's the shocking revelation. What's the most important thing to do? Prevention. You don't really want to be in the situation where you're shutting the barn door and the cow's already out. So we'd really like to know about things that are helpful to keep the brain working its best. And there's nutritional factors as well as those social factors we'll be talking about. Now, I do want to mention that there are memory changes that are temporary, and those can be associated when you have stress, a lot deal of stress, or a loss, like in grieving, when you just, kind of temporarily have a hard time thinking. That's not dementia, that's a temporary memory loss. And then you also have to remember that sometimes memory loss can be associated with developing a disease that may have been brought on by inflammation, oxidative stress, or hormone imbalance, or atherosclerosis. For instance, you can have a very low thyroid and have problems remembering things. Okay, so risk factors for dementia. Interestingly enough, the risk factors for dementia are the same as the risk factors for heart disease for the most part. So think about those things that you are trying to do for a healthy heart. They also help for a healthy brain. So things like inflammation, an elevated C-reactive protein, that's a risk factor. An elevated homocysteine is a risk factor. A high ratio of those omega-6 to omega-3 fatty acids, that's a risk factor. A poor lipid profile, meaning the wrong kinds of LDL cholesterol, that can be a risk factor. Although you don't want a cholesterol level of 0 because you do have some cholesterol in the brain. Obesity is a risk factor for both heart disease and dementia. Depression is for both. And having a poor diet, not only eating too many of those trans fats, but also eating too few fruits and vegetables. Okay, so let's talk a little bit about inflammation. There's a tool called C-reactive protein which helps measure inflammation in the body. It's not specific about where the inflammation is, but it's very sensitive and it can detect inflammation whether it's acute or chronic or systemic. And C-reactive protein has been shown to be an early risk factor for Alzheimer's. So it's something that's an easy lab test that your doctor can do. In a Mayo Clinic study, they found that this very sensitive, that's what HS means, it just means it's a very sensitive C-reactive protein test, meaning they actually give you a number of your C-reactive protein versus saying, yes, you have some, and no, you don't. But they said that indicated the presence and severity of plaques in the general population. Okay, and then I mentioned that an increased homocysteine was a risk factor. Well, this was several studies. One of them, this Italian study, they found that elevated homocysteine and low folate levels, that's folic acid, one of the B vitamins, were associated with a risk of developing dementia and Alzheimer's. And in another study, actually there were a couple of studies. This one had about 1,500 patients, and then this study was another one with about 1,700 patients. And they found that Alzheimer's patients had a much higher level of the homocysteine, and they thought that served also as a risk marker. So that's also a test that your doctor can order. And the most striking thing about this study is they picked a level. They found a level. If your homocysteine level is above 14, you have twice the risk of developing Alzheimer's. So when you get your homocysteine level back, if it's under 14, they'll say it's so-called normal, but you really like it under 8. And you certainly don't want it over 14. Okay. And more studies linking homocysteine dementia. In Scotland, they had a study where they just looked at elevated homocysteine levels associated with poor cognition. Now, cognition is just a fancy term for thinking. So when you see cognition, think thinking. Now, in a Dutch study, they found that higher levels of homocysteine were associated with silent brain infarcts. So that means that was a risk factor for the multi-infarct dementia. So both of those things show that high homocysteine levels are a risk factor. Now we're going to talk some more about other biochemical markers like your fatty acids, because your brain has so much fat in it. The fatty acids and the profile of your fatty acids turns out to be very important. And something that we don't think about very much is energy that the brain needs. The brain really requires a lot of energy. 25% of the body's energy is used by the brain. I mean, that's a quarter. So being a very energy-hungry little organism up here, we're going to talk about those things that help with brain energy. And hormone imbalance, like I mentioned, the thyroid, that's a risk factor. And then we're going to talk about those B vitamins and antioxidant status. But first of all, let's talk about reducing inflammation. Now, if you come back with an elevated C-reactive protein, that indicates there's some inflammation going on. And the reason oxidative inflammation is a problem in the body is all this oxidative stress causes damage to the DNA and other cellular components. And you definitely want to reduce your oxidative stresses. Well, the simplest things that we hear about all the time is how unhealthy smoking is. Well, it's also unhealthy for the brain. Stress. It's one of those things that we can't exactly avoid, but we can learn to manage, because that causes oxidative stress, and so does, for example, poor diet and obesity. So we'll talk about all those vitamins, including CoQ10, that are important as antioxidants. CoQ10 is one of these energy molecules that the body can make, but as we get older, we make less. And one of the other important things to help with reducing inflammation is eliminating those trans fatty acids in the diet. And do we know where trans fatty acids come from? Anybody? Partially hydrogenated vegetable oils. Yes. Okay. And these days, it should be on your label of your foods. You can look out to avoid trans fats and partially hydrogenated vegetable oils by taking your magnifying glass with you to the grocery store so you can see all the fine print on the labels. That's what I do. And then here's an interesting thing. The fiber is known to help you lower your C-reactive protein, which is inflammation. So fiber, we think of whole grains, but there's other things that have fiber: beans, seeds and nuts, and fruits and vegetables. All right, and of course, when you're avoiding your trans fats, you also want to improve the amount of the omega-3 fatty acids to help reduce inflammation, and those omega-3 fatty acids are the ones that we get in those fatty fish, like in salmon. Okay, so reducing homocysteine. This is done by methylation. Homocysteine is a molecule we're making. It's a risk factor if it's building up. Both it's a risk factor for heart disease and for dementia. And what we need to methylate it or break it down are some particular B vitamins. Folate, which is folic acid. Vitamin B12 and vitamin B6 are all necessary for the breakdown of the homocysteine. And there's a couple of problems as we get older with our intake of these vitamins. For one, we have an increased need for B6. So unless we've increased our consumption by 20%, we're not going to meet our need for B6. And then the other thing is our poor absorption of B12 from food as we get older. Because of lower acid in the stomach, we may not be absorbing our B12 from food. A recent study in Boston looked at folks between the ages of 70 and 79, and they found that a third of them had a B12 deficiency. And then in studies where they've actually used B12 and folate, for instance, they looked at B12 and folate in this study and found that people who had low levels already in their blood had a greater risk of developing cognitive impairment. That means they can't think well. What they do is they give them these tests that where they have to think through problems, and those cognitive tests, or the tests that test cognition, if they're not doing well, then they're at risk for impairment. Now, here was a really interesting study where they had folks who had a low B12 level, and over 5 months worth of B12 injections, that's one way of getting your B12 is an injection, they had people improve with their functioning, both like the cognitive function and overall memory. So that's why those B vitamins, those particular ones are especially important. They're doing all these fancy things called methylation, which in your chemistry is just what's called a one-carbon transfer, but in your metabolism it does many things. And the carbon group, which is the one carbon and the 3 hydrogens, is just called methyl group. And this methylation process is involved in many things, including DNA synthesis and the metabolism of neurotransmitters using another molecule called SAM, which is S-adenosylmethionine. So all of these things are part of the metabolism that is requiring your B12, your folate, and your B6. So there was another study where they gave folks 800 micrograms. Folate is always in micrograms unless it's up to 1,000 micrograms, and then it's 1 milligram. And sometimes you see that, especially in prenatal vitamins. But in this study, they gave folks 800 micrograms of folate for 3 years, and they got their homocysteine levels down by 26% and had an improvement in their thinking and their cognitive function. Okay, that brings us to our fat heads. 70% of the brain is fat, and half of that are those omega-3 fatty acids that we call EPA and DHA for short. They have a very long chemical name that I don't even like to pronounce. So those are really important, and those are the ones that we get in primarily our fatty fish. And brain cells, they need a certain amount of flexibility in this word fluidity to function well. And we also know that of those two, the EPA and DHA, EPA is a very good anti-inflammatory, and the DHA is really important for normal brain development. so that they even now are putting it in some infant formulas. And of course, breastfeeding babies will get it from their moms. Now, one of the problems with those trans fats that are come from the partially hydrogenated vegetable oils is they can get incorporated into brain cell membranes, and trans fats are stiffer. They make the membrane stiffer when they get in there, and so that decreases the fluidity. We need the fluidity for those brain cells to talk. So that's another reason that we want to avoid those partially hydrogenated fats. And if we're eating polyunsaturated fats like the omega-3s, will help to displace some of those trans fats, which we have acquired over the years because it was very prevalent in our food supply, shortenings and margarines and baked goods. So what you want to do is improve your balance of fatty acids, especially these omega-3, EPA, and DHA. And this observation began quite a few years ago when the Dutch published this study that looked at about 1,600 people over 5 years and found that the more fish people ate, the better their brain functioned. And I don't know if you guys remember, when I was little, fish was considered brain food. And I had people say, oh, no, that's silly, because I'd try to go through a lot of cans of tuna right before a test or something. It doesn't quite work that way, of course. But this study found that people do function better if they eat more fish. And, of course, the ones that are the best are these fatty fish like salmon, mackerel, sardines, herring, and trout that swims in cold water, because the fish oils, those fatty acids, are kind of being used for insulation in their muscles. And then, of course, the cod liver is a good source of those fish oils, too. Okay, now no talk of dementia would be complete without mentioning vitamin E. Remember how oxidative damage is a risk factor for dementia. Well, your antioxidants are vitamin A, C, and E, as well as CoQ10. But A, C, and E we talk about a lot because we know them as essential nutrients, meaning you got to get them in your diet. And there was a study quite a while back that looked at using a lot of vitamin E, 2,000 international units in folks to help with the progression of dementia. More recent studies have been kind of interesting. This is something from 2005 that used 2,000 IUs of vitamin E in quite a few patients, about 700 for 3 years, and they didn't really find any difference in the progression to Alzheimer's versus the people who were getting placebo. Then there was a brand new one that was interesting because they did the same thing. They had people take 1,000 twice a day, so that was 2,000 vitamin E a day, and they tracked them for 15 years. Well, the interesting thing is they didn't have any statistical significance in improving Alzheimer's, but what they did have was improvement in their survival. And of course, we've gotten a lot of publicity lately about vitamin E being a risk factor for death. Well, this found just the opposite. There was a 26% increase in survival or lifespan in those people who were getting the 2,000 of vitamin E a day. And I want to mention something that just came out this July, which was a study that looked at about 4,500 people who were over 65, and they found that if they were consuming vitamin C in the range of 500 to 1,500 milligrams a day, and vitamin E in the range of 400 to 1,000 IUs a day, they had a decreased prevalence and risk of Alzheimer's disease. So again, those antioxidant nutrients are really important. Now, I mentioned hormonal decline with age. This can also be a risk factor for dementia. DHEA, which is a prohormone produced by the adrenal glands, may improve acetylcholine. Okay, well, acetylcholine is that neurotransmitter we need for good brain plasticity, and meaning it helps the cells communicate. And we know low thyroid levels affect concentration and memory. Your thyroid can be so low that, and I've seen this, where people look catatonic. And we had a lady when I was a medical student who had to be hospitalized because she had become literally unable to move and function, and her thyroid was low. It was very low, and it took weeks. Actually, it took months. But once it was up to speed, she was up and cracking jokes. It was amazing. So think about the hormones. Thyroid is important, and estrogen is something we know that protects the brain and improves memory. And some other studies are showing that testosterone may help protect against some of those beta amyloid plaques in the brain. And DHEA is like I mentioned, is the prohormone produced by the adrenal glands. It's a prohormone in that its next step is either to form estrogen or testosterone. So you can see how it may also be part of this help with the brain as well. Also want to point out that low levels of any of these hormones is also associated with depression. And depression is a risk factor for dementia, just like it is a risk factor for heart disease. Okay, now we're going to talk about the energy of the brain. Remember, it's a real brain sink. A quarter of our body's energy is needed for the brain. So with all this heavy metabolism going on for energy, what kind of molecules are really critical? Well, that's that CoQ10. It's a very important energy molecule that's in the mitochondria, breakdown or oxidation in your cellular membranes. And then there's a couple of important energy things here that you may have heard about. Acetyl L-carnitine. It helps to transport fatty acids into the brain mitochondria where all the energy action is taking place. And then there's something called alpha-lipoic acid. And it's involved in energy production in many different facets. It's something, alpha-lipoic acid is in every cell in our body. And it's important for not only energy production, but it's important for recycling other antioxidants, particularly vitamin C, which is ascorbic acid, that's vitamin C, and something called glutathione. So all these are important for energy as well as preventing oxidative damage. And one thing I want to make a mention to is, like, your body makes coenzyme Q10, and it'll make carnitine. And the first step in making CoQ10 for the body, it requires vitamin B6. We've already talked about B6 being important. Well, it's going to be important for your body to make CoQ10. Now, let's just kind of touch a little bit. There are medical factors, chronic diseases that people have that can affect memory. And we've already talked about heart disease, since they share a lot of the risk factors. I mentioned depression. That's a risk factor for dementia. So is high blood pressure, stroke, because if you're having strokes, that means you may be having multi-infarct dementia, where you're having little strokes in the brain. Diabetes is a risk factor, so is obesity. And some folks with Parkinson's disease have problems with mental decline and memory problems. And then, let's not forget medications. If you ever look at the list that comes with from the pharmacist on the side effects of medications, it can be pretty appalling. But what happens as folks get older is they get put on a lot of medicines, and all these different side effects may be building up on each other, kind of a symbiotic increase in side effects. But so you can definitely have mental confusion and memory loss with too many medications. It's what we call polypharmacy, if you're suffering from side effects from so many of those medicines. Okay, well, let's talk a little bit about that risk factor, obesity. It's now considered the most common chronic disease. They say that at least 60% of us are overweight. That's not the same as being obese, but there was a really interesting study that looked at what being overweight is going to do to us later on as far as our brain function goes. And this study looked at like over 10,000 people. And they found if you were overweight in middle age, you were 35% more likely to be diagnosed with Alzheimer's or dementia in later life. Now that's overweight. 60% of us are overweight. Okay, for those who were obese, it went up. If you were obese in middle age, it went up to 74% more likely to develop dementia, which is a pretty astounding number. And they even factored out things like, people having heart disease or diabetes or high blood pressure or cholesterol. It was just being overweight in middle age puts you at that much risk. This was a big study that was published back in 2005. So lots of things to do to reduce your risk of obesity. And I'm actually going to be doing a lecture in October on obesity and some of the strategies that really do work because it's important to try to maintain a normal body weight. And just to give you a little snippet here, guess what? Eating more fruits and vegetables. Doesn't that theme come up a lot? And this is an interesting finding. If you get more sleep, you are at less risk of becoming obese. Or let's put it another way. If you have poor sleep, it increases your risk of becoming obese. You'd think that if you're out, doing more things and sleeping less, you're burning calories. It doesn't work that way. The body actually needs to rejuvenate. And no surprise, exercising more helps to reduce your risk of obesity. And then I read this interesting study that says that found out that if you live in a better neighborhood, you have less risk of obesity. They didn't quite know why. Just one of those many socioeconomic factors they were looking at in a study. And then, of course, actually maintaining a positive attitude is important for dementia. All right, so let's talk a little bit about fruits and vegetables. This was an interesting study that's fairly recent where they did a meta-analysis that looked at reduction of stroke. There was 11% reduction in stroke for those who ate 3 to 5 servings of fruits and vegetables. And if they ate more than 5 servings of fruits and vegetables, they had a 26% reduction in strokes. Now you want to reduce your strokes because that sets you up for multi-infarct dementia. And what percent of Americans do you think actually consume 5 servings of fruits and vegetables? Less than 10%. So we're really going to be in trouble as time goes on. Okay, now a British study followed 20,000 people for 10 years, and this was interesting. They measured their vitamin C levels, and those who had the higher vitamin C levels had a 42% lower risk of stroke. And their conclusion was, if these people had higher vitamin C levels, they must be eating more fruits and vegetables, which is pretty logical because that's where you get your vitamin C is from fruits and vegetables. You're not going to get it from meat and fat. Okay, other things that are important, exercise. That's probably not a surprise either. There was a study that looked at 1,500 people between the ages of 65 and 79, and just exercising twice a week. This is midlife when the risk of obesity is biggest. They found a 50% lowering risk of developing dementia, and 60% lower risk of actual developing Alzheimer's, just twice a week. And then there was another study that looked at 1,700 folks for about 6 years, and they were exercising 3 or more times a week, and they also found a decreased rate of dementia. Now, one of the things about exercise is interesting is it helps to prevent brain shrinkage. And even though there's some of this sort of normal shrinkage with age, You know, if we shrink less, it would be better. But the Alzheimer's folks were shrinking, had the twice as much shrinkage. So exercise helps that. And exercise helps depression. And depression is a risk factor for dementia as well as heart disease. So exercise is a win-win. Now, speaking of depression, there was this big Australian study, 2,800 men, women, 65 or older. Free living means they were still living in the community. They weren't in any nursing homes. They were followed for 16 years. And those who had a higher depression score, they had a predicted 50% higher risk of dementia. So depression put them at a 50% risk of dementia. And this being an Australian study, they looked at all sorts of things, and I thought this was kind of interesting. For this study, any intake of alcohol lowered the risk. Now, those Australians like to drink beer, so I imagine they were very happy with this result. I guess it wasn't skewed. Now, daily gardening, that lowered the risk. And daily walking was particularly important for men. Both men and women could garden and lower the risk, but walking was more important for women. So I figured, you know, the guy can go out and take his glass of red wine for a walk, and the woman can take her glass out into the garden. And there you have your reduced risk. Now here's some positive things that are actually helpful. They have observed in studies lowering your risk of dementia, and that is higher education. Now, you can look at it a lot of ways. People who maybe have a higher education level are using their brain more, or maybe they just have more memory to lose before they get to where dementia is actually recognized. There's all sorts of ways to look at that. But one of the things that's protective also is that mental exercise, keeping your brain active. Whether, you know, it's playing bridge, doing crossword puzzles, or cuss word puzzles, as my aunt used to say. But just, you know, making that brain maintain its plasticity. And then there was this study that looked at people who had a positive perception of their health had less risk of dementia. Now that means they thought they were in pretty good health. So, you know, thinking positively about yourself and your health can actually have a benefit. And then there was the what I call the contentment study, where they found that folks who had more hostility had a higher C-reactive protein, that CRP. Well, remember that CRP is an indicator of oxidative inflammation. So, got to get rid of that hostility. That's why we have Blue Rock out there. So you can go throw clay pigeons against a backboard and hear them break. It's good for you. Now, keeping socially active, this is also very protective for the brain. Isolation is not good, but being out there and being socially active, that can help with both your, brain plasticity as well as your positive self-perception. Now, let's just talk a little bit about all those dietary factors, since there always has to be something about diet in my lectures. The sources of antioxidants, we'll just kind of review. Vitamin A comes from liver, cod liver oil, and then there's beta-carotene, which our body can make into vitamin A, which comes from sweet potatoes, carrots, and things that are, that nice orange color like squash, pumpkin, and you see collards. That's any kind of greens. They have a lot of beta-carotene. Okay, they're not orange, they're green, but that's because the chlorophyll shades the beta-carotene, but those carotenoids are in your greens. So dark green leafy vegetable a day keeps the doctor away. That should be part of your 5 servings a day. Vitamin E, that's a fat-soluble vitamin, so you have it in your nuts and wheat germ and seeds, and you can also get a little in spinach. And then CoQ10 your body is making. We don't really get appreciable amounts from our diet. They tend to be from meat products and some oils, but when you're heating them too high, like in frying, poof, there goes the CoQ10. That's also true of vitamin E. Now your B vitamins, folic acid, again, dark green leafy things. Brewer's yeast is a good source of almost all B vitamins, except B12. Beans are good, so are sunflower seeds. B6, beans again. Bananas, potatoes, fish, watermelon, again, the brewer's yeast. Now B12 you can only get from meat products. So that would be meat, poultry, fish, eggs, dairy, or oysters. Niacin is from meat, fish, peanuts, potatoes, and thiamine from meat, particularly pork, seeds and nuts, and beans and peas. And you're going, wait a minute, did we talk about niacin and thiamine? Alrighty, niacin is B3 and thiamine is B1. And when you study about deficiency diseases, one of the characteristics of a deficiency in niacin is dementia. It's actually the 3 Ds, dementia, dermatitis, and diarrhea. That's if you have no niacin available. The deficiency of thiamine or B1 is also known to manifest as dementia. So there's a lot of things that historically were part of good nutrition where when people were very malnourished, dementia actually was one of the outcomes. Briefly, I might just mention that we do make L-carnitine, but being in we make it in our liver, and it needs other nutrients to be made, like iron, amino acids, vitamin C, B6, you see that again, and B3. We get a little bit also. Carnitine is amino acid, so we get it in protein foods. Alpha-lipoic acid, it's like I was telling you, it's both antioxidant and important for energy, and we tend to get that sort of in meats as well, a little bit in some vegetables, but we're hopefully depending on our body to also make some. Now, when we talk about fruits and vegetables, you want to get your 5+ or more servings a day, and think about those colors. The more colorful, the better. And when I speak of color, it's those blues and purples, the greens, the reds, the orange and yellow and white. Okay, I know white's not a color, but things like garlic and white grape and onions and cauliflower, they actually have antioxidant potential too. Now, I just wanted to mention other research that's going on, especially because y'all may have heard the blueberry story. Blueberries actually can help our brains quite a bit, and they're polyphenols. Historically, they've been studied in blueberries, and these are compounds we call phytochemicals. They're things in our plant foods that we are characterizing. So this helps you to understand that you can't just get everything from a supplement. You actually have to eat foods, because we're still figuring out some of those helpful things that are in our foods that haven't been labeled as an essential vitamin mineral. And blueberries and their polyphenols are a good example. And I saw a recent study on polyphenols coming from grapeseed as well. But they have found blueberries in rats being fed the equivalent for a human serving, like a cup, actually improved their memory and helped them make a little bit more brain cells, actually stimulated some neurons there. So that's some of the things that are going on with all those nice colorful fruits and vegetables. There's been some research on this stuff called hyperazine A, which comes from Chinese moss. Garlic has shown some promise being helpful for the brain. Curcumin is an anti-inflammatory, can be helpful. Hyperbaric oxygen may be helpful in early stages, not in later stages. And no lecture would be complete without mentioning vitamin D. You could add that down at the bottom of the list. The latest research I read that was a study where they found people who had low levels of vitamin D, like less than 20, and I've seen a fair amount of that after this long winter we've had, they had both low mood, which means depression, as well as really poor cognitive function. So don't forget the vitamin D, as that's the sunshine vitamin. So let's review the keys for managing stress. You want to minimize inflammation, and stress has a lot to do with cortisol depletion and stress on your adrenal glands. You want to minimize depression. And heart disease, you want to exercise for strength, flexibility, balance, cardiovascular benefit. You want to maintain a healthy weight and a healthy mental and social outlook. And you want to make those dietary changes that include more whole foods with fiber, colorful fruits and vegetables, beans. They have fiber as well as good protein and all those healthy fats in our nuts and seeds and fatty fish. And if you're interested, here at the center we have a lot of tapes on different things about aging and dementia, inflammation. You can get a lot more information and expand on that. And I would like to thank everybody for coming, and remember to exercise your mind. We're going to have time for questions, and there's microphones coming down because I like to record the questions. So if you just hold up your hand, there's microphones are on the move here.
Be sure and raise your hand. We'll come around, and if you haven't filled out the little slip of paper, if you do so, we'll pick that up too.
I had a cousin several years ago whose husband developed Alzheimer's, and long before he was finally diagnosed by a doctor, he would sit and just rub his head, and his wife asked him, "Do you have a headache?" And he'd say, "Oh, just feel my head, it's burning up." Could he actually sense the brain cells burning?
I don't know.
But he'd say, "Oh, just feel my head." And he'd have her lay her hand on it. And of course, he wouldn't be hot. Yeah. He just said, "My head's just burning up."
He was sensing something wasn't right. Yeah. I sometimes think we sometimes miss out on actually paying attention to our body wisdom. And something, he knew something was going on. That is interesting. Yeah.
Did you say that CoQ10 and EPA and DHA are the same thing? That is, EPA and DHA is omega-3?
Now, the EPA and DHA are omega-3 fatty acids. The three principal omega-3 fatty acids are the EPA, the DHA, and what we call alpha-linolenic acid, which is what we get from like flaxseed. CoQ10 is a different molecule.
Okay, but those things are in omega-3 when you eat omega-3.
CoQ10?
No, EPA and DHA.
Yes. Well, yeah, you have to check your label. If you're taking a supplement that says omega-3, I would check to see how much EPA and DHA it has in it, because they could just make it out of flax, and that's an omega-3, which is the alpha-linolenic omega-3, but it's not as effective. At least the studies have really found it's the EPA and DHA in your omega-3s that's the real big actors.
Okay.
Yeah.
Thank you.
You're welcome.
Doctor, I'd like to ask about the brain cell and nerve reproduction.
Can brain cells be repaired? Can a nerve cell be regenerated?
Well, there is some evidence. She's asking if brain cells can be regenerated. It was in those rats. You know, the rats that were fed all those blueberries, which had the polyphenols, and one of the things that's in polyphenols is the anthocyanins, which are that beautiful purple color. And they were having some regeneration. So that's quite likely. Now, when we're talking about some of this biochemistry, we're talking more about prevention of like the oxidation and trying to prevent the tangles and things like that. Okay.
Get this C-reactive protein checked in a normal physical? Will it be paid for by Medicare and insurance?
Well, I never guarantee what Medicare and insurance will pay, but your regular doctor can order a C-reactive protein and a homocysteine. Those are done in regular labs. So, yes, you ought to be able to ask for that, and it will be something that they've heard of, so they won't be looking at you funny.
Regarding physical exercise, generally speaking, would you rather have intense exercise for a short time or more gentle exercise for a longer time?
Well, now that's a whole exercise study. There's a lot of studies that show interval training may be helpful where you get a little bit of both, a little bit of walking with a little bit of jogging. However, a lot of the things where I've read where they have looked at exercise being helpful for things like obesity, heart disease, or dementia, they're talking about moderate. Because they're following people who are out doing things like walking. They're not following athletes who are doing the heavy-duty stuff. Yeah, you're welcome.
Is there a way to detox your body from trans fatty acids that have been stored in your body for years before you begin to eat?
Yeah, she's asking about detoxing out of those trans fats that we've all been exposed to for so long. One of the best ways, besides just avoiding it, is getting all the polyunsaturated fats, and yes, they can displace those trans fats out of the tissues. So polyunsaturated fats, the most important, especially for the brain and protecting the heart, are those omega-3s. Yeah. Okay, let's see, who's next?
I was wondering how much is a serving of fruits and vegetables?
Okay.
Can you eat them all in one
Serving,
time?
and you can. How much is a serving of fruits and vegetables, and can you eat them all at the same time? And you can. A serving of fruits and vegetables, if you have the fluffy, like green leaves, like in a salad, that's a cup. So a cup is a serving. But if it's a chopped fruit or vegetable, a half a cup is a serving. And that's not, if you get out your measuring, half a cup, that's not an overabundance. If it's a cooked vegetable, half a cup also applies. So I think it's helpful to get out the measuring utensils. You say, well, half a cup, I can eat a half a cup, 5 times a day. Or what a cup of leafy greens would be for a serving. It's pretty doable. And we just got through with a health incentive among the staff here trying to catalog the servings of fruits and vegetables. And I would really encourage everybody to do that, because often you think you're doing a really good job. And there's some days when voila, you may not have had anything in the fruit and vegetable category. So, and then there's some days you may do really well, but it's really worth keeping a little calendar and just, making a little mark for every, half cup of a chopped fruit or vegetable, or a cup of leafy greens. And if you're eating a piece of fruit, it's a small piece of fruit, what we call a 2-inch diameter apple, which is not a very big apple, or half a banana. So if it's raw fruit, it's a fairly small size. So if you're eating a bigger piece of fruit, that would actually be 2 servings. And still 10% of Americans aren't getting their 5 fruits and vegetables. So go figure. Yeah. Okay.
What do the abbreviations EPA and DHA stand for?
Okay, EPA and DHA, icopentanoic acid and dexahexanoic acid. So that's why we like to abbreviate them. They're very long chain fatty acids, so we like to give them their little short nicknames.
Yeah, I take a gel capsule that's 3, 6, and 9s because I read someplace a while back that you should take them all in balance. And what is your take on this?
Well, what we do here is we actually measure your fatty acids, so that gives you the chance to really find out where your balance is. The 3s, when they have a 3, 6, 9 capsule, the 3s will either be your fish oils or it'll be something like flax oil, or maybe a combination. Your 6s will just be plain old vegetable oil, and we get plenty of that. And the 9s are your monounsaturates. So that's what's in like olive oil, nuts and seeds. So we generally do pretty well with the 6s and the 9s in our diet. It's the 3s that we have a harder time with because, you know, most of us aren't eating fish every day.
Meat eaters versus veggies, who comes out ahead on this?
Well, you can eat a good vegetarian diet if you really, you know, do a good job at it. You can't, you know, live on refined carbohydrates as a vegetarian, which sometimes young people like to try. But one of the things that I might just point out with vegetarians, if they're a vegan and they're not even getting milk and eggs, they may get behind on their B12. And we know B12 is so important for the brain because B12 is only found in animal products. So,
I take a daily vitamin, but what's the common sense of deciding what kind of vitamins to take? Because you mentioned lots of vitamins here.
Well, I'm at an advantage because here at the center we actually measure levels of vitamins and minerals, so it takes a lot of guesswork out because people are so different. We all have a different biochemical individual need for certain nutrients. So the amount of zinc or the amount of vitamin A I need might be different from what you need. But when you are shopping for a multi, you'd want to look for something that has a well-rounded amount of vitamins and minerals because there's only so much they can pack into a vitamin. But the other thing I might stress is look for ones that don't have a lot of extraneous stuff, you know, like colors and sugar and fillers. Because if you're taking it every day, you don't want to be, you know, getting all those sort of unusual additives that you don't really need. And another thing that's helpful is to actually quiz the store you're buying it from to see if they have any backup data on whether those nutrient or that vitamin pill has been tested by an independent lab to have so that it shows that it has in it what it says it has in it. Because vitamins are not FDA regulated.
Upstairs in the Gift of Health, the vitamin products that we do sell, we have a notebook up there that shows the independent lab testing results. So it's really interesting to look at. All of our vitamins are tested.
Yep.
I have a question, Dr. Kirby, about something I'm taking which has fruits in it and vegetables in a capsule, everything you need each day. What is your opinion of that resource for getting your fruits and vegetables?
Well, when I've recommended those, it's usually been when people are just adamant about not getting them in their diet, because that's always where you want to go first, is actually sculpting your diet around fruits and vegetables, because 5 is the minimum, and 10 is even better. So if you are eating more fruits and vegetables, you're crowding out all those trans fats, sugary calories, refined foods. So you're just building a diet that's better, that's going to give you, a higher chance of taking care of your heart, your brain, as well as your health.
The preceding program was presented by the Center for the Improvement of Human Functioning International in the Bright Spot for Health Lunch and Lecture Series. To inquire about additional health-related information available on DVD, audio CD, VHS, or audio cassette, simply call 316-682-3100 or drop by 3100 North Hillside in Wichita, Kansas. To discover more about the center and what we have to offer, be sure and visit us on the web at www.brightspot.org.